Subcommittee of the Alcohol and Drug Policy Commission. And we are on the record. So thank you to our staff for being present and for teeing up some interesting issues and discussion points for today. So with that, unless anyone has any, so we've got our esteemed chair, Dr. Vesna. We've got Don Mazziotti. We've got Kelly Minty Moore. In terms of commissioners, myself, Nate, our vice chair, Nate Gowran. Nate, are you on?
I don't see him.
Okay. Do we see any other members, just for the record?
No.
Okay. All right. Good. Well then, Jill, shall we get started?
Sure.
You?
Sure. So, Tony, I didn't realize that you were a doctor. I'll make sure to appropriately address you in the future. And all right. So our first bill today that we're going to talk about is House Bill 4098, which is our bill. It's the bill that puts items from Goal 1 of the strategic plan into statute. And as we talked about last week, there is a second part to this bill now, and that is the enabling legislation DOJ needed for the Johnson & Johnson opioid settlement. The House Behavioral Health Committee adopted the DOJ amendment into the bill and sent it to Ways and Means. So it is currently in Ways and Means. However, there is an informational hearing about House Bill 4098 next week. It's on Tuesday in the Senate Human Services, Mental Health, and Recovery Committee. So I think most everybody knows that once the bill was sent to Ways and Means, that meant the bill would not appear in a Senate Policy Committee. But there were some senators who were interested in hearing more about the bill. So that is the reason it is having an informational hearing next week in a Senate Policy Committee. It will be similar to the hearing that we had on the House side, which is Dr. Richardson is talking about the ADPC portion of the bill, and DOJ is talking about the opioid settlement part of the bill. We discussed at a very high level about the opioid settlement, that it is creating another board that board determines where the state's share of the opioid settlement monies, how it will be dispersed. But ADPC has a seat on that new board, and one of the guiding documents for the board is the strategic plan. So as we discussed the last time we met, we're in a much better place on those amendments, and the bill is moving forward. Yay, I thought that this might be drama yet again on our bill that brings it down, but it is moving forward. So everything looks on a very positive note for it. I'll stop there and just ask, does anybody have any questions about House Bill 4098?
Jill, Don Mazziotti, I do have a question.
Yeah.
Is it possible to add anything to this bill at this point?
I would say no. But Don,
Okay.
Is there something that you wanted to add to the bill?
Well, in the list, assuming that we're talking about 4098, Section 2, which lists the agencies with whom we communicate.
Okay.
I would suggest that PEB be added to that list of entities. The reason I suggest that is that PEB maintains the master contract for employee assistant programs for about 401,000 state employees or their families. And these can be instrumental in all sorts of substance abuse disorder matters, but in particular for prevention. And I've spoken with a person who manages the PEB program and believes that, it's very effective, and they would like to cooperate with us.
Thanks, Don. PEB is a part of OHA, and OHA is on the list.
Okay, they indicated to me they were an independent freestanding entity, but if that's not correct, great, they're included.
Mm-hmm.
Huh.
Yeah, and Don, this is Tony, and I know that
Yeah.
I've reached out to you before about like interest in scheduling a time to meet with this individual as well, to pull them into our work and some maybe outside organizing. So that
Yeah, they'd like to
invitation's
come
still
and speak to the commission.
Sure, yeah, and I suggested that too, and I also suggested that if they're interested in participating, they can show up and be there and give public comment too.
Well, I think the first step would be a presentation to the prevention subcommittee.
Sounds like a good plan. So Jill, you said that PEB is part of OHA. That's your understanding. Okay.
Mm-hmm.
I did not know that either. I thought it was a freestanding entity, but
Yeah, I didn't realize it either.
okay.
So just real quick, because I know that Dawn, you've brought this up probably 10 times since I've been on the commission, and so I'm just wondering if there's a way to get you to email Tony Bigland and get the process started of getting this person involved if you think it's going to be really beneficial.
I've already done that.
Okay.
I've also communicated to Tori. I've asked Tori what the protocol is for a subcommittee presentation by the executive of PEB in charge of the master contract.
Okay, so we're just waiting for them to respond.
So here's what I'd like to do, Don, is find a time at the actual commission meeting and have the PEB exec come and talk to us about the EAP, because EAP is not a prevention program.
It is a prevention program, to the contrary.
Well, all right. Well, we won't debate that point, but
why would we debate? Why would we debate that point anyway?
Well,
because you're incorrect. That's why we might debate it. But I tried to walk away from.
Well, then they must be incorrect, because I spoke to them about this in some detail.
Okay. Well, so I think that excuse me just for a moment. It seems like really on the important piece here, everybody's on the same page, which is that the work that PEB is doing generally and has the ability to do could further aspects of our statewide plan. I think it is, and I think it's a really important issue, Don. And frankly, I'm not on the prevention committee, but I think it's probably something that's potentially significant enough that it would, the entire commission could benefit from it. That's going to be Dr. Richardson's call along with Tony, but it sounds like Dr. Richardson was proposing just that, and so maybe I think that's, to me, that's the most important piece with all due respect. So let's look forward to that.
Excellent.
I have the contact information from the PEB person, and I'll reach out to them and get them scheduled.
Okay.
And then Tony, did I see that you had a question as well?
Relating to 4098.
Yeah.
Yeah, I just wanted to know if who the senators were who requested it, and if it was like basically just an inquiry, or if there was concern, or if you had any of kind of the back end details around why they wanted to hear about it.
No concern.
Okay.
They wanted, so one of the senators who asked to have the informational hearing is the senator who is appointed to our commission. It was Senator Solman. And I think her point was just making sure that her Senate colleagues knew about the bill, because otherwise there would be no policy discussion on the Senate side. It would just be the Ways and Means discussion that happens after this.
Good.
Sounds good. It sounds like it's actually more of a supportive role.
Mm-hmm.
Solman's a big cheerleader of ours.
Mm-hmm.
Yeah.
And then
Dr. Richardson, which is great.
Yeah, and the chair of the Senate Human Services, Mental Health and Recovery Committee is Senator Gelser Bluin, who has been very supportive of the strategic plan in the past. So I can very much see that she would have been very amenable to this suggestion.
Awesome, thank you.
Yeah.
Okay, good. Well, it sounds like things are definitely moving in a positive direction on that bill. Any other questions before we move to the next? Okay. Thanks, everybody.
All right. So our next bill, excuse me, is House Bill 4004. And again, all of the bills we've talked about, so these are bills that should all sound familiar to you. House Bill 4004, we discussed last time, is a bill trying to provide some additional financial assistance to behavioral health treatment providers. The supporters of the bill have said that they wanted to act kind of like the Paycheck Protection Act. So in other words, there would be a pot of money and providers would apply to have a grant from this pot of money. And then the providers, in order to use that money, they have to agree to allocate 75% of the grant that comes to them directly to worker compensation, and the other 25% they can use in a variety of ways to help support their staff. So it could be like childcare assistance, something that lots of behavioral health, well, actually lots of employers, period, have said that their staff has been asking for. The bill contains a couple other sections that aren't as important to our work. I just want to make it clear that if you did read the bill, there are some other sections to it, but the major section is this one about providing financial assistance to behavioral health treatment providers, and that's the part of the bill that we are most interested in. The bill passed the House Behavioral Health Committee. It is also going to Ways and Means, where it will be worked out exactly how much what is the exact allocation that is going to happen for this financial support for behavioral health treatment providers. And you know how the legislature frequently is like high school and there are rumors about everything. The rumor about this bill is that the legislature is looking at about $200 million allocation for this bill. So this is short-term assistance for behavioral health treatment providers. It is definitely not seen by legislators or others as a long-term fix. But the, again, the rumored amount is about $200 million that could be going out the door very soon. The bill requires the financial assistance to be out the door from OHA by May 31st of this year. So this could be money that is going out the door to providers very soon to help them with all of the needs they have had. I'll stop there again and just see if there are any questions about House Bill 4004.
Questions?
I don't have a question, but I will say that something that was very encouraging during the work session in the House Behavioral Health Committee was the OHA CFO presented on increasing the reimbursement rates and what that would do financially to the system. And I thought that was a really good precursor to what could happen in the future around increasing reimbursement rates, which would really improve the infrastructure problems we're having right now.
Other questions?
That was a great comment, Tony. I will say my impression of the OHA presentation was that it was confusing, but you are absolutely right. They were trying, I think, to tee up the conversation, saying that House Bill 4004 is really the short-term measure that we're trying to take, but that the long term, or in the long term, we really need to look at reimbursement rates. So I think they were trying to tee up that conversation probably for next session about reimbursement rates.
Right. It's the difference between a bonus and a raise. The current bill is like a bonus, but then it goes away. A raise is what they need. I had a question. So, assuming that the rumored amount, Jill, of $200 million is what ends up happening, or something in that ballpark, given the number of providers and the number of employees, et cetera, who would be eligible, I mean, do we have any sense of, is 200 million or a decent amount? Is it sort of a drop in the bucket? I mean, how does that pencil out?
So that is a great question. And I know others have been following this bill. So if you have additional information than what I'm going to say, please jump in. One of the things I heard from the legislators themselves is that it is really difficult for OHA to pinpoint what is the need and how much is that. And that this bill, they're making some assumptions about how much they have that they can put in this pot of money, but that actually they will need to do some reassessment to see at some point, some reassessment to see if there is more need than what was put in this pot of money. And if there is, how they can provide some more financial assistance. So to answer your question, Judge Block, I think it is still a question to be answered about whether this is going to meet the majority of need out there, or if there is going to be more and the legislature is going to need to do additional actions to cover that need.
Okay.
Yeah, Jill, maybe help me understand one thing about it if you can. So originally I thought it was going to be more of a paycheck protection thing, like, hey, we lost this money and we need to cover that deficit. But then when I listened to the hearing, it seemed like it was more of a workforce crisis bill, in the sense that people could hire staff and recruit staff to work. And then so I was like, okay, they brought up reimbursement rates. So I figured, okay, their idea is to expand the infrastructure with this and then sustain it later on.
Mm-hmm.
So does that make sense? Do you know if it's to cover lost revenue, or a deficit, or is it to add additional workers?
So here's my understanding of it. And, I haven't been involved in any of the primary discussions on it. I've just been listening to what other people have said. So my understanding is that the supporters of this bill, the sponsors of it, have described it as similar to the Paycheck Protection Act, in the fact that, a provider would have to apply to receive a grant, and then the provider has to agree to use 75% of that grant directly toward worker compensation, which I think was similar to how the Paycheck Protection Act worked. Then to your second point, but can't they use at least part of this money for recruitment, for new people? I think the answer is yes, that they can use this money for recruitment as well. So I think it can go both ways for your question, that it can go to support some lost revenue, but that support really needs to be targeted toward worker compensation. It can also be used for recruitment, perhaps of new staff. So I think ultimately the answer to your question is yes and yes.
Yes.
Okay, thank you.
And that's my understanding too, that it's, as long as it either supports existing employees or leads to the hiring of new employees, because the intention is really to support work, jobs and workforce.
Mm-hmm.
It's okay. Any other questions? Okay. What else you got, Jill?
All right. We'll move on to House Bill 4016. House Bill 4016 was the bill that OLCC requested. This is the bill that would allow them to deny licenses, or I should say, I think the terminology they're using is a moratorium, that they can put a moratorium on issuing licenses for marijuana production, both marijuana producers, marijuana retailers, the whole system there. And as we discussed in our last meeting, OLCC has said they need this ability because there is an overproduction of marijuana in Oregon, and that there is a concern that a lot of that marijuana is going to the black market, or what they term the gray market. They do not want that to happen, and so they're trying a policy idea to bring down the production of, or the overproduction of marijuana. There had been several amendments discussed to this bill, one of them being taking some ballot measure 110 money and allocating it to a program that the Criminal Justice Commission oversees regarding, it's a long name, the Illegal Marijuana Market Enforcement Grant Program, I think is what it's called. That amendment was not adopted into this bill. So this bill remains, I think, what OLCC originally had planned it to be, which is just the moratorium. So this is one that for ADPC we were tracking. We weren't really involved in it, but just tracking it to make sure that we knew the progress of this bill. And it also passed out of committee, and it had its Ways and Means reference rescinded on it. So it's going straight to the floor of the House, and it is making its way through session. Are there any questions about House Bill 4016? Okay, I'll, excuse me, it's not on our bill list, but I'll just make sure everybody is aware. There's a bill that for ADPC, we're just tracking. We're not involved in it. It is House Bill 4074, if anybody would like to look it up. It has to do with requiring that there is a position at OLCC that responds to, that takes complaints and responds to any information that person receives about human trafficking going on in the marijuana industry. That bill also passed out of committee and is making its way. I think that one did have a Ways and Means reference, so it's going to Ways and Means, but just to make sure everybody knows, it looks like OLCC is going to get a position, and that position is going to be dedicated to responding to complaints about human trafficking in the marijuana industry.
Okay, any comments, questions, or dare I say concerns about that?
Yeah.
All right.
Okay.
Moving on.
Yes. House Bill 4056, we talked about this bill last time. This was one that was sponsored by Representative Nathanson, and it went to her committee, which was the Revenue Committee. This bill is the one that adjusts the marijuana distribution monies. So for the part of the marijuana distribution formula that happens before monies are transferred to ballot measure 110. So there's a certain percentage that goes to cities, a certain percentage that goes to counties, and some other areas. Those monies now, or I should say that part of the marijuana revenue dollars will now be, or this bill says that they will be adjusted annually for inflation. So the Legislative Revenue Office estimates that the first year that this bill would be effective, that would be about $1 million more that's going to the distribution formula before monies are transferred to ballot measure 110. We were just, again, tracking this bill, not involved in it, just wanting to know the progress of it. That bill has already passed the House, and it is now in the Senate, so it is speeding along its way through the legislature. Are there any questions about House Bill 4056? All right, I'm going to take silence as a no. All right. We will move on to House Bill 4081. 4081 was the bill that required pharmacists to offer a prescription for naloxone whenever they were dispensing what was termed a higher risk opioid prescription. So the higher risk opioid prescription would be if there's a prescription for an opioid over a certain dosage, things like that. The bill passed out of the House Healthcare Committee, and we were, in our last meeting, we said perhaps we would like to submit testimony on this bill. We were late submitting testimony, but I was able to contact the sponsor of the bill and say, who happens to also be the chair of the House Healthcare Committee, and just say that this bill is in alignment with the strategic plan. And during the work session on Monday, she actually put that on the record that the bill is in alignment with Oregon's strategic plan for substance use services. So we got that on the record. The bill passed out of committee. And so that bill also is moving on its way this session. Excuse me. Are there any questions about House Bill 4081?
Jill, I have a question.
Yeah.
Do you know if a pharmacist is the only way to get naloxone or Narcan?
Well, no. I mean, it can be prescribed to you from your prescriber. There are also organizations that hand it out.
Yeah, I'm just asking because it's treated over the counter in Texas, California, Tennessee, and a number of other states. And I wonder why we're being so strict about its distribution. Is there any discussion of that or no?
I haven't heard anybody discuss about making it a non-prescription or an over-the-counter. I haven't heard anybody bring that up.
Okay. I just think it's very strict compared to other states that don't have anywhere near the number of drug incidents as Oregon does, but I guess there's no chance to modify these in any particular way.
I think the state's working on it. One thing that OHA is rolling out right now is called Save Lives Oregon. And Save Lives Oregon is a consortium of individuals or a group of individuals that's gonna lead rollout of harm reduction services across the state, including the distribution of Narcan. And they have a clearinghouse. Organizations can order Narcan. One of the issues that we've had with Narcan is that there's been a limited supply due to supply chain issues.
Exactly. Yeah, I understand. I can't get it for the homeless folks that I work with.
Yeah, it sounds like that's certainly an important policy issue, Don. That maybe should be the subject of a bill in the next legislature. This one, I don't think you were on the call last week, but the fact that because apparently, and I don't want to mischaracterize this, but it's, if I recall correctly, the pharmacists were opposed to this bill because they viewed it as extra work for them, and the fact that it's making progress, obviously, if you think that Narcan should be more accessible in more ways under more circumstances, then the fact that it's made this progress despite some opposition is a good thing.
Okay, thank you.
Yeah.
Yes, I would agree that, so to answer your first question, Don, no, I don't think that there is an ability at this point to change this bill. But to your overall point about, I think just increasing access to naloxone in general, yes, that there's always room for that discussion in the future.
Right, thank you.
Okay. Any other questions regarding this bill?
There's a question. I'm sorry, Molly. I don't know. I see a question from you about, is there a way to leverage FQHC buying power to provide naloxone to providers in supportive housing? And I am unable to answer that question.
Molly, you there?
Yes, I'm here. I was just wondering, because I know you can use the Minnesota multi-state. I thought at least, their way to actually acquire this drug, and if so, for every FQHC throughout the state, would be their way to stock this up and then provide it to their supportive housing structures that they're currently working with.
Okay. Okay. Well.
And Don, if you want to get some naloxone for the organization you work with or another one, just email me and I can help facilitate that with some harm reductionists I know or with the state.
Great. Thanks very much, Tony.
Okay. Any other questions regarding this particular bill relating to pharmacists being required to facilitate naloxone to folks receiving high-risk opiate prescriptions? Okay. All right, Jill, you want to move on to the next?
Yeah. Our next bill is Senate Bill 1512. Excuse me, I'm still getting over the cold my toddler brought home from daycare. Senate Bill 1512 has to do with limiting how licensing agencies, how they can look at criminal histories of someone who is applying for an occupational license. The bill also says that that a licensing agency can't use the fact that somebody has a conviction or has committed a crime as a reason for denying them an occupational license unless that crime is substantially related to the job's duties and responsibilities, and it gives some guidance on what substantially relates means. There was a lot of discussion in the Judiciary Committee about this bill, and there have been some amendments to it. A lot of the amendments have to do with further narrowing how an occupation or a licensing board, how they can use any kind of information about somebody's juvenile record, and it's narrowing that even further. The bill, as amended, it passed out of the Judiciary Committee. So this bill also is making progress this legislative session and is moving along. This is one of the bills that we submitted written testimony about and said that it is in alignment with the strategic plan about reducing employment barriers for people who have criminal histories. That got on the record. And so there are two bills this session that we have made sure to voice our support as much as a state agency can voice support about bills. And so I'm really pleased with us. Both bills that we have contributed comments on are both moving. But for the moment, I will stop and see if anybody has any questions about Senate Bill 1512.
Any questions? I just had a clarification, Jill. As I understand it, the plan references as a goal reducing the impact of criminal convictions for individuals who suffered those convictions in connection with substance use disorder or some substance related illness. It's not a more general statement than that. Is that accurate?
I think the way that we have been describing it in the strategic plan is that we wanted to reduce employment barriers for people who have criminal histories, especially when those criminal histories are substance use related criminal histories.
Right. That's, yeah. It's the nexus. We may think it's a good thing generally, to have criminal convictions create less barriers for employment for anyone convicted of a crime, but the nexus between the ADPC's work and that issue is the relation that there are people who are suffering criminal convictions because of untreated substance use disorder, and we want those convictions to have minimal impacts on employment.
Yes.
Okay.
Yeah. And you know, one of the discussions that we had multiple times while we were developing the strategic plan was how many people who had criminal histories that were quite old, and that those criminal histories were still impacting their lives, whether it was, you know, particularly with jobs, housing. Sure. And so in the bill, in Senate Bill 1512, one of the items of guidance that this bill provides on whether the crime is substantially related to the job's duties and responsibilities, one of the things that licensing agencies are now statutorily required to do, if this bill were to pass, is look at the time between when the crime was committed or when that offense happened and now, and that the longer in time means that it is less substantially related to the job's duties and responsibilities. So it's saying many of the things we discussed and saying many of the reasons why we have reducing employment barriers in this strategic plan.
Right. No, that's excellent, and it's a good, you know, it's just one more piece of sort of the overall tapestry, like, you know, companion piece to 819, where folks can just seek, you know, to have criminal convictions set aside completely, or, you know, or just a more robust use of the expungement statutes. So, okay, thank you.
Yeah. That was the last bill on our list. The last thing I'll talk about, which is not on our list because I don't know that there's a bill number yet, is that there is going to be a general fund request for Harmony Academy, which is the Recovery High School. It's called the Recovery High School Initiative, I believe is what it's called. And some of the people working on that initiative talked to us about this this fiscal ask that they were going to make. And there's a plan, it's a two-part plan. One is that they're asking for what they're calling bridge funding this session. So in other words, some funds just to make sure Harmony Academy stays open and is continuing to provide the services that it needs to provide right now. And then it is looking at a work group this interim to discuss about more long-term funding ideas for Harmony Academy and other recovery high schools that may open across the state. So that financial ask, that fiscal, is going to happen in there's usually an end of session bill that has a whole bunch of general fund requests. That requests will appear in that bill. So I just wanted to alert everyone that there is a financial ask that we are very supportive of. It aligns very well with the strategic plan, and I will keep you more up to date about what happens with that financial ask when we get closer to the time when the legislature is actually allocating money. Are there any questions about that? All right. And with that, we are done updating about our bills and our funding asks for this session. Well, I mean, session's still going, but for today, we are done discussing the bills on our list.
Great job.
Yeah, as always. So Jill, we've got, in terms of our schedule, I think we agreed we would meet more frequently in session. So are we going to be meeting again next Wednesday? Is that the plan?
Our next meeting is scheduled for March 2nd, which would be during the last week of session. So I think that's actually a good time to meet, because right about now is the point in session when there's a lot of Ways and Means activity going on, and I'm not sure how much of an update I would have next week. But I should have a much better idea of what's actually happening 2 weeks from now. So meeting on March 2nd actually works out really well.
Okay. And when does the session schedule to end?
Yeah, it officially is scheduled to end on March 7th.
Okay. Okay. Any other questions, comments, asks, suggestions for Jill's next update? You can always send those in to her in the interim. And Jill, I had one that I was thinking maybe you could just give us a little bit of an update on. And have you looked at? There's a bill, as I understand it, to fund the creation of 4 family treatment courts across the state. These would be for minors who are in the system in connection with some with some crimes that they've committed, thought to be related to substance use disorder and maybe some other behavioral health issues. And I've heard about it through an OJD briefing, but I'm mostly interested in if you could just take a look at it with Dr. Richardson's agreement and just sort of give it a general look at to see how it might promote some of the features of our plan.
Mm-hmm.
Not anything. Yeah.
I'm familiar with the bill that is to expand the existing project, the family court project, working with families that are child welfare involved.
Yeah.
Which that's a go. Because we've. So I don't know about the one you just mentioned, if they're the same or if they're actually a complete another one.
Yeah, Dr. Richardson, I'm not sure either. Let me get a bill number, and I'll pass it on to you and Jill, and maybe it's the same, and it's just some follow-up work that's going on in this session, or maybe it's something additional. Okay.
Great.
Mm-hmm.
Thank you. All right. Anything else for the good of the order here? All right. Well, I certainly want to thank you, Jill and Dr. Richardson, for keeping track of all this for us. And I have to say, again, just because I've been on this the commission for a while, the difference between how we're functioning now and our capacity, our presence in the legislative session, it's like night and day. So I really appreciate the progress that's being made, and the issues that are benefiting from the ADPC's more robust actions. So, Tony, anything else you wanted to add?
No, not at this time.
Okay. All right. So we do want to just check in with any public comment. Are there any members of the public who wish to make any statements, offer any comments at this time?
Hi, I'm Molly McClure.
Molly?
How are you guys? I just want to say first and
Good.
foremost, thank you for all the work you are doing on behalf of the Alcohol Policy Drug Commission. I work with Cedar Hills Hospital, and so I'm excited that I could be a part of what you're tracking and paying attention to as we're trying to do the same thing. So thank you.
Great. Thank you for taking time to be here with us and for providing us with some of your thoughts and information, and please continue to do so. We need all the help we can get. We're all in this together.
Yeah, we're happy to be a partner.
Yeah, great. Any other members of the public wishing to comment? All right, hearing none. Thank you to members for participating, and we'll be back together Wednesday, March 2nd at 3:30. All right. Thank you.
Thank you. Bye.
Bye-bye.